Scientists used low-intensity ultrasound waves to treat an aggressive and fatal brain tumor. The ultrasound device is implanted in the skull and uses tiny bubbles to open the blood-brain barrier to deliver drugs to the brain. The blood-brain barrier is a thin protective layer of specialized cells lining the very small blood vessels guarding the human brain. It keeps out the bad stuff, such as pathogens, but it also prevents potentially useful things from getting in. As a result, virtually all medications for conditions such as brain cancer and neurodegenerative diseases are effectively unable to reach the site where they are needed most. The challenge is that the brain is an extraordinarily fragile organ. Any damage is irreversible, which is why researchers want new strategies to bypass the blood-brain barrier. Methods such as surgical injection have been tried in the past, but they involve skin incisions, holes in the skull, and passing instruments through the brain. This carries a risk of infection, bleeding, and swelling, which could cause permanent brain damage. The focused ultrasound technique is a non-invasive way to open the blood-brain barrier. In Phase 1 clinical trial, the ultrasound device was implanted in the skull of 17 glioblastoma patients. A few weeks later, their treatment began with common chemotherapy drugs. In normal circumstances, these medicines do not cross the blood-brain barrier, but the ultrasound device works by making tiny bubbles vibrate inside the brain's blood vessels, temporarily making the protective outer layer permeable. The researchers found that opening the barrier led to a 4 to 6-fold increase in drug concentrations in the human brain. The study also showed how quickly the blood-brain barrier closes after being opened by the ultrasound. It closes in the first 30 to 60 minutes after the communication. This will help scientists optimize what order to deliver the drugs to allow for better penetration of the brain. Scientists developed a hydrogel that can revert cancer cells back to cancer stem cells in just 24 hours, which will make them an easy target for drugs. Cancer stem cells are found within tumors and have the ability to self-renew and differentiate into various types of cancer cells. They are notorious for being resistant to chemotherapy and radiotherapy and for hiding in body tissues and causing cancer recurrence. The new hydrogel is called double network DN gel. It's composed of 2 chemicals and water, giving it characteristics similar to those of biological tissue. The researchers placed cancer cells on the double network gel, and they formed spherical structures and produced specific molecules known to be markers of cancer stem cells. These types of cells are difficult to identify, but they are a major target for anti-cancer drugs because they are resistant to chemotherapies and radiotherapies. The hydrogel was tested in 6 different human cancer types and could lead to the development of various cancer therapies, including anti-cancer stem cell drugs and personalized medicines.
Scientists used sound waves to destroy cancer cells, and the tumors removed by the non-invasive sound technology didn't come back. This new therapy could significantly improve treatments for cancer and neurological conditions. In recent experiments, researchers have found that the sound technology can break down liver tumors in rats and kills cancer cells. This could also enhance the immune system to prevent further spread. By destroying only 50% to 75% of the liver tumor volume, the rats' immune systems were able to clear away the rest, and researchers didn't find any evidence of recurrence or metastases in more than 80% of animals. Even when they didn't target the entire tumor, the therapy still caused the tumor to regress. The results also showed that the treatment stimulated the rat's immune system, which possibly contributes to the regression of the untargeted portion of the tumor and preventing further spread of the cancer. The innovative treatment, called histotripsy, non-invasively focuses ultrasound waves to mechanically destroy target tissue with millimeter precision. Unlike current approaches such as radiation and chemotherapy, this new sound wave technique works without harmful side effects. The device delivers high-amplitude microsecond-length ultrasound pulses to specifically focus on the tumor and break it up. The microsecond-long pulses generate microbubbles within the targeted tissues, rapidly expanding and collapsing. These violent but extremely localized mechanical stresses kill cancer cells and break up the tumor's structure.